All right, now let's discuss this further. We're now joined via Teams by TAC Gauteng chairperson Monwabisi Mbasa. Thank you so much for your time and a very good afternoon to you. So what is the Gauteng Department of Health's reasons to you about its failure to provide these, of course, life-saving treatment, to cancer patients, despite, as we've heard in that clip, funds being available to them?
Yeah, no, sure. Thanks, Unati, and thank you very much to the viewers. I would like to greet the viewers at home of SABC. Yes, today actually we will submit memorandum. So we had our march today. We were marching to the department to go and express our anger for this failure to actually spend the amount of money that has been already set aside by the Gauteng Treasury in order to get treatment for these patients who are living with cancer. So today we have sent our memorandum, which was received by the HOD of the department and other senior members of the staff in the office of the MEC.
Now, in your memorandum, I would imagine that you are also complaining about the tender process that was used, for the outsourcing of this oncology radiation treatment. We understand, of course, this started about 7 months ago. Just talk to us about what happened to that tender. Do you know anything? And what relief will the service provider, if there is one, give?
Okay, so actually you are quite correct in terms of the period that this matter has been dragged for. However, we the ones actually who had recommended to the department to say, in the meantime, since you don't have a capacity to be able to administer this saving process, would rather use this 784 million rands to outsource the resources since you do not have a capacity in the department. And the tender was advertised. However, they became mum. There was no transparency in terms of what had happened to that particular tender process. So far, part of the memorandum, the crux of that memorandum were saying, give us the update as to how far you have gone in terms of outsourcing these resources, actually outsourcing these services to a competent service provider. So within the 7 days that we've allocated, 7 working days, we want to receive now a full report to say how far have they gone. Do we now have a service provider that has been appointed? They have checked capacity and the legitimacy of that particular service provider in order for these interventions to be done as an immediate intervention. The long-term intervention is for government to procure more equipment and machines to ensure that there's consistency in terms of provision of these services.
And behind your request, and this is an important one just to get our viewers to understand the sense of this crisis. We're talking here about 3,000 patients that cannot access the radiology oncology services in the province. Just talk to us about, which areas are hardest hit at this point.
The hardest hit area, it is Gauteng in general, but you will find high exponential numbers rising in Ekurhuleni, in Tshwane, and some in the city of Johannesburg. But the crisis now, it's cross-cutting. That is why in our statement we were saying one patient dying is too many. Therefore, the 3,000 is not just statistics, but these are warm bodies who are severely affected and are people who do not have the means to actually get these services from private healthcare, and also are people who have become now an abandon, or rather a burden in their families, because now they are living in empty hope because government is sitting on top of the money, arrogantly so. So that has been the issue.
And that was going to be my next question, to say that, in your statement, you do describe, how some patients have passed on while you're waiting for the department to act. Just paint us a picture of the impact this has on not only the patients, but their families too.
Okay, no, I will be very succinct in responding to that question. When we are saying it's 3,000 patients whose lives are plunged in chaos, the number goes beyond that, because we still don't have an updated statistics around this particular number. However, we're still benchmarking on the basis of the scientific conclusion that we had of 3,000. The number could be more than that, despite the fact that there are those who are dying already. Now, I want to paint you a very clear picture. In the families, you'll be aware that since the economy is not growing, then majority of the working class, people who are living in the deprived areas, people who are living in destitute, are people that cannot afford just to get food, basic amenities. Now you can imagine living with a cancer patient who requires a special attention, which in part requires money. And once now those people cannot be taken care of, it becomes a traumatic experience for the family members alone. And notwithstanding the person now who has to reel from pain, very, very, very sharp pain, yet the money to ensure that person receives the treatment is there sitting with government, but unfortunately, due to the political will, the money is not spent for 3 years as we speak today. So that on its own, the impact is far dire and severe and very inhumane if you were to get it that way.
All right, Monwabisi, thank you so much for that. Of course, a very important story, this one. We will be monitoring it very closely. Thank you so much for your time.